The Neurologic System, Chapter 21. The spinal cord is a conduction pathway for impulses going to and from the brain. It serves as a reflex center for nerve impulse transmission. The parasympathetic nervous system is composed of the sensory organs: eyes, ears, taste buds, olfactory receptors, and touch receptors, 12 pairs of cranial nerves, 31 pairs of spinal nerves and ganglia that link the sensory organs, muscles, and other parts of the body to the brain and the spinal cord. Neurons react to stimuli, conduct impulses, and influence other neurons. The axons of many neurons bundled together and wrapped in a connective tissue make up a nerve. The stimulus travels from one neuron to another across the synapse, which is the space between two neurons. A neurotransmitter secreted by the neuron is necessary for transmission of an impulse across the synapse. Acetylcholine, dopamine, and norepinephrine are the major neurotransmitters. Impulses travel in a reflex arc that goes to the spinal cord and then travel back to the effector site, or the impulses can travel along the nerve pathways to the brain to be interpreted. After interpretation, a message may be sent from the brain through the spinal cord or cranial nerves for appropriate action to be taken. A stimulus produces a response. The cerebrum is the center of intellect and consciousness. It receives and interprets sensory information, controls voluntary movements and some involuntary movements, responsible for thinking, learning, language capability, judgment, and personality, and stores memories. The cerebellum is responsible for coordination of movement, posture, and muscle tone that are the mechanisms of balance. Diencephalon, which actually consists of two parts, the thalamus and the hypothalamus. The thalamus is the relay center between the spinal cord and the cerebrum. The hypothalamus controls body temperature, appetite, and water balance, and it links the nervous and the endocrine systems. The brainstem consists of three parts: midbrain, pons, medulla oblongata. The midbrain mediates visual and auditory reflexes, controls cranial nerves 3 and 4, and certain eye movements. The pons links various parts of the brain, helps regulate respiration. The medulla oblongata contains reticular formation that regulates the heartbeat, respiration, and blood pressure. It controls the center for swallowing, coughing, sneezing, and vomiting, and it relays messages to other parts of the brain. The distribution pathways of the spinal nerves are called dermatomes. Cranial nerve 1, olfactory, controls it's a sensory nerve that is for smell. Cranial nerve 2, the optic nerve. It's a sensory nerve for visual acuity, field of vision, and pupillary response. Cranial nerve 3, ocular motor. It's a motor nerve. It's for eyelid elevation, extraocular eye movement, pupil size, convergence, and pupillary constriction. Cranial nerve 4, trochlear nerve. It's a motor nerve. It's for extraocular eye movement. Cranial nerve 5, trigeminal nerve. It's a sensory nerve for corneal reflex. It is also a motor nerve for facial sensation, chewing, biting, lateral jaw movement. Cranial nerve 6, abducens. It's a motor nerve. It's for extraocular eye movement. Cranial nerve 7, facial nerve. It's a sensory nerve for taste and a motor nerve for facial muscle movement, including muscles of expression, lacrimal gland, and salivary gland control. Cranial nerve 8, acoustic nerve, is a sensory nerve. It's for hearing and sense of balance. Cranial nerve 9, glossopharyngeal, is a sensory nerve for sensations of the throat and taste on the posterior tongue, and it's a motor nerve for the gagging and swallowing movements. Cranial nerve 10, the vagus nerve. It's a sensory nerve for sensations of the posterior tongue, throat, larynx, impulses from the heart, lungs, bronchi, and gastrointestinal tract, and it's a motor nerve for the initiation of swallow and phonation. Cranial nerve 11. It's a spinal accessory nerve. It's a motor nerve for shoulder movement and head rotation. Cranial nerve 12. The hypoglossal nerve. It's a motor nerve for tongue movement and articulation of speech. The body functions for homeostasis and voluntary mechanisms are controlled by somatic nervous system and the autonomic nervous system. The functions of the somatic nervous system result in moving skeletal muscles. The autonomic nervous system helps maintain homeostasis by regulating organ systems. The peripheral nervous system is divided into an afferent division, which carries impulses to the central nervous system, and an efferent division that carries impulses away from the central nervous system. A reflex arc is a simple conduction pathway, and it uses a receptor and a motor neuron that are located in an effector. The stimulus travels from the sensory receptor through the spinal cord and back to the effector, causing an action. Bones of the skull and vertebral column form the outer layer of protection for the brain and spinal cord. Cerebral spinal fluid cushions and protects the brain and spinal cord. It is formed continuously as a filtrate from blood. The volume of cerebral spinal fluid stays constant that measured during lumbar puncture is 100 to 180 centimeters of water pressure when lying on the side, and 200 to 300 centimeters of water pressure when sitting. The brain requires constant flow of oxygen to function. Neurons are sensitive to oxygen. They die quickly when deprived and cannot survive anoxia for more than 4 to 6 minutes. Intracranial pressure, or ICP, is the pressure within the skull, and it is normally 5 to 15 millimeters of mercury. Acetylcholine. It's generally excitatory, but is inhibitory to some visceral effector or skeletal neuromuscular junctions. Norepinephrine may be excitatory or inhibitory depending on the receptors. Epinephrine may be excitatory or inhibitory depending on the receptors. This is concerned with mood and behavior. Dopamine is generally excitatory. Pathways that regulate emotional responses. Serotonin is generally inhibitory. Pathways that regulate temperature, sensory perception, mood, and onset of sleep. Gamma aminobutyric acid, or GABA, is generally an inhibitor. It inhibits excessive discharge of neurons. Glutamic acid, or glutamate, is generally excitatory, facilitates signals between nerve cells, and has a role in learning and memory. Endorphins and enkephalins, generally inhibitory. They increase the release of sensory pain neurotransmitters, and opiates will mimic the effects. The CNS cells cannot regenerate. Once they are destroyed, the cells in the brain die. Slower impulse transmission and resilient, slower reaction time occurs in older adults. Blood flow to the brain is decreased with advanced age. In late adulthood, changes can cause decreased sensation. When providing care for a patient with right hemiplegia from a stroke, the nurse should remind the patient to pay attention to the left side, protect extremities during transfers, support unaffected arm with pillows, use slings on the affected arm to promote better balance, initiate range of motion exercises. The correct answer is 2, 4, and 5. The nurse should teach about the dangers of recreational drug use. A possible stroke can be caused from using crack cocaine or methamphetamine, as well as the damaging effect of too much alcohol on the brain cells. The nurse should also teach about control of hypertension and cholesterol, because this can reduce the number of strokes and the damage that the stroke may cause. Genetic or developmental disorders, cerebral palsy, muscular dystrophy, or Huntington disease. Trauma would be head injury, penetrating brain injury, spinal cord injury, ruptured intervertebral disc. Cerebrovascular would be a cerebrovascular accident, a ruptured aneurysm, arteriovenous malformation, migraine, or cluster headache. A tumor, be a brain tumor or spinal cord tumor. Infection, meningitis, encephalitis, brain abscess, spinal abscess, poliomyelitis, Guillain-Barré syndrome. Neuromuscular disorders, multiple sclerosis, myasthenia gravis, amyotrophic lateral sclerosis. Degenerative disorders, Parkinson's disease, Alzheimer's disease. Cranial nerve disorders, Bell palsy, trigeminal neuralgia. Mental acuity, memory, and emotional stability need to be assessed. The assessment of cognitive function is part of every patient encounter with the nurse. Cognitive changes may be the first sign of hypoxia, drug reaction, or other conditions affecting the nervous system. The licensed practical or vocational nurse assists registered nurses with gathering data for a neurological assessment. Reflex is an action or movement built into the nervous system and does not need conscious thought to take place. It is an automatic response. Reflexes are graded as follows. 0 out of 5 is absent, 1 of 5 is a weak response, 2 of 5 is normal, 3 of 5 is an exaggerated response, and 4 of 5 is hyperreflexia with clonus. Doll's eye reflex examiner places a hand on each side of the patient's head, using the thumbs to gently hold open the eyelids. While watching the patient's eye, the head is rotated briskly to one side and the eye movement is observed in relation to head movement. If the brainstem pathways are intact, the eyes appear to move in a direction opposite to that of the head movement. Therefore, if the head is rotated to the right, the eyes appear to move to the left. This finding is a positive Doll's eye reflex and indicates an intact brainstem. If the eyes remain stationary and do not appear to move and passively follow the head motion, the result is considered a negative Doll's eye reflex, and this is abnormal. The full outline of unresponsiveness, or 4 score, is preferred for comatose or intubated patients who cannot speak. A score of 0 to 4 is assigned in each of 4 categories: the eye, motor, brainstem, and respiratory function. Score of 0 indicates no function, and a score of 4 indicates normal function. Diagnostic tests that may be used are basic physiological testing that is done to rule out a disease in some other system that might affect the nervous system. A nerve or muscle biopsy may be done to determine pathologic changes in tissue. This is an example of a pupil gauge whenever we are checking the pupils, and this is how to do cardinal positions or cardinal fields of gaze. Here the patient keeps the head still and follows a finger with their eyes only. Posturing includes flexor posturing decorticate. This is an extension and stiffening of the legs, adduction of the arms with the forearms bent upward, and the wrists and fingers flexed on the chest. This type of posturing occurs with damage to the cortex. Extensor posturing decerebrate. This is where the arms are stiffly extended and held close to the body. The wrists are flexed outward and the legs are stiff with the toes pointed downward in plantar flexion. This means damage to the midbrain or brainstem and indicates a very serious injury. These are common nursing diagnoses that may be used frequently with neurological damage or issues.